Therasphere is a radioembolizing tool for the treatment of hepatocellular carcinoma, also known as more commonly as liver cancer. The treatment itself consists of millions of microscopic microspheres that are actually made from glass delivered into the body via the hepatic artery while the patient is conscious. It's an alternative to traditional EBRT techniques and can increase survival rates dramatically for unresectable cancers of the liver. In a study, the increased survival rate went from 258 days to 800 days. This treatment uses yttrium-90 to deliver radiation. It is a radioactive isotope. Yttrium-90 is more commonly known as yttrium, which is the non-radioactive element. The element number is 39, and it's used in many industrial applications, such as laser cutters for metal, as well as it used to be used in tubes for televisions to make the color red. Its melting point is just over 2,700 degrees, which means it can be melted into the glass spheres. Glass melts a little bit lower than that, but is significantly fluid at 2,400 degrees. So, yttrium is a beta emitter in the radioactive isotope form of Y90. That means it does not give off gamma or alpha. It is a beta emitter, particularly B negative. It has a half-life of 2.67 days and delivers an average energy of 0.9367 megaelectron volts. It is the byproduct of strontium-90, which is actually used in nuclear reactors. After the yttrium-90 has radioactively decayed, it becomes zirconium-90, which is the most common radioactive isotope of zirconium. Therasphere works by the process of transarterial radioembolization, or TARE. What this means is that the radioactive microspheres of glass, which are 20 to 30 micrometers in diameter, are permanently lodged into the tumor vessels themselves, thereby delivering the radiation directly to the tumor. These microspheres that are 20 to 30 micrometers in diameter deliver 95% of the dose needed within the first 2 weeks of treatment. Two acts of Congress, such as the Orphan Drug Act of 1984 and the Safe Medical Devices Act of 1990, allow devices and drugs to be used that affect fewer than 200,000 patients annually. Therasphere is classified as a humanitarian use device, which means it can be used on fewer than that number of people. The American Cancer Society estimates that 42,810 new cases of liver cancer will be diagnosed in 2020, making it an ideal device. There are several reasons that could make a candidate optimal for treatment using Therasphere. Patients with surgically unresectable tumors, which would include 75% of patients at presentation, patients with portal vein thrombosis, and patients who are simply waiting for a liver transplant or surgery, as well as those who are hoping to have some sort of downstaging effect from the treatment so that they can undergo surgery and or a transplant. Any patient where the liver is the primary site or major site of metastatic disease could also qualify a patient. And of course, liver function is always tested, medical history is examined, previous therapies are considered, as well as the ECOG status of the patient. Much like a CT SIM before any sort of EBRT treatment, there is a planning process for Therasphere. First thing that is done is a mapping angiogram once a patient has been determined to be ideal. The catheter or floppy guide wire is inserted into the body via the femoral or left radial artery. At that point, back doors such as the gastric and gastroduodenal artery, are embolized because these are ways that the glass microspheres can exit the liver, and it's important to make sure that the radiation stays in the liver in the region of the tumor. So some arteries in and near the liver are blocked intentionally before treatment. One of the ways that this can be seen is using technetium-99 macroaggregated albumin as a contrast agent so that one can see where the blood is flowing and where it needs to be blocked. The good news is that collateral blood channels will develop and supply the other parts of the liver or other organs that need blood where the area has been embolized or blocked. The beginning of treatment starts with a pain medication and a sedative inserted into the catheter before the catheter is fully inserted. So at the point of the vein being accessed, that's how that process begins. Before the catheter is fully inserted, lidocaine and nitroglycerin are delivered, as well as a hemodiluted artery cocktail, which will prevent spasm and clotting. So basically, we're looking for pain relief, making sure that clotting won't happen, making sure spasming won't happen, and then since the patient is conscious, these things are all very important. After those have been delivered to the blood in the artery, the Y90 is delivered. The process itself is actually surprisingly simple, and the recovery is fairly short. Most patients are in the clinic from 2 to 6 hours for the whole process. Generally, the planning angiogram is done before and not on the same day or at the same time, but usually those two appointments are relatively close to one another. Therasphere can be an ideal treatment for many patients. There are many reasons that one would choose it. It is minimally invasive. There's no skin reaction, there's minimal side effects, usually just a little bit of nausea or fatigue, but nothing too serious. It is an outpatient procedure, and it improves the time to progression. So the progression of the disease occurs significantly slower with the Therasphere process. It can be done more than once if the patient needs that, and it increases the opportunities for surgical resection or transplant down the road for those patients of liver cancer.
There we go. Dot there is the tip of our microcatheter, a small little micro wire out, and the tip of our base catheter, the original big one we went in, is just still engaged right in the celiac there. So our catheter tip's in the right spot. Cue Y90 montage. Check for any radioactivity that might have spilled on us or on our hands, feet, just to make sure we contain everything.
If you were on fire, you would be.
Therasphere is an effective alternative to external beam radiation therapy for hepatocellular carcinoma patients. Therasphere is a minimally invasive procedure that can dramatically aid in improving the prognosis for many patients with liver cancer.